It's always rewarding to see patients in the community, especially after they're completely through their course of treatment and they're back to normal activities and enjoying life again. And their sincere appreciation for everything we've done is always one of the best parts of our job. I'm Dr. Douglas Lundy. I'm an orthopedic surgeon specializing in orthopedic trauma and musculoskeletal injuries. Most of the time when we first see our patients, it's in the hospital after they've been brought in by ambulance or EMS. Sometimes we see patients for the first time in the office if they've been referred from other physicians. We do a full assessment of their injury, of their imaging studies that have occurred beforehand, of their current state, of their expectations of where they want to go and how much this is going to impact their life overall. We talk about reasonable methods to manage pain control, and then we move on to the litany of opportunity that we have to try to reconstruct their injuries back to a normal position. We see all sorts of patients with musculoskeletal injuries, mostly fractures, outside the spine, the skull, and the hand. And so these range in patients who are severe trauma patients that come in off of motor vehicle collisions, to patients who have routine fractures from slips and falls, to patients who have had previous injuries in the past that either healed incorrectly or didn't heal at all. I think it's very important to make the right connection with the patient because these are people that are often in significant need, and if you can meet them at their level of need and try to help them move along to gain back normal function, we really have the opportunity to help people often in one of the most crisis moments of their lives. I'm married with 2 children, and we decided to move to Colorado after my fellowship for 7 years. And then the Lord of the South recalled us back to Georgia, and we've been here ever since. I'm involved in leadership at Resurgens Orthopaedics. I'm also heavily involved in our national organizations where I'm on the board of the Orthopaedic Trauma Association and also on the board of directors of the American Board of Orthopedic Surgery. We help to influence the standard of care and practice of orthopedic surgeons throughout the United States of America. I did my fellowship with Ken Johnson, who was one of the greatest orthopedic trauma surgeons in America at the time, and it was a great experience. Without question, the most meaningful opportunities and things that I do are the medical mission work in the developing world, specifically in sub-Saharan Africa, where we are actually training African doctors to become surgeons and stay in Africa to help the care of the poor and needy there. It's very important to remember that patients are not fractures, that patients have fractures, and that we're not treating the x-ray itself. Ironically, many times it's known well throughout orthopedic trauma that the fracture is often the easiest thing to heal. It's the surrounding soft tissue envelope that is much more difficult to heal, and more than that, 90+% of all patients with severe musculoskeletal injury actually suffer from true clinical grade depression. So we try to help folks get their head around their injury, get whatever appropriate help they need from a psychological standpoint to be able to deal with this, and then try to keep their spirits up as much as we can so that they can persevere through the entire course of care until they're able to return to normal life. I really like helping people who are in times of significant need and having the ability to help reconstruct their severe injuries and helping them get back to a more normal state of life.